A very big hello to dear students and all friends, and I welcome you all to the next video of this series on clinical examination of swellings. Well, in my last video, we had started with the palpation of swellings and we had seen about the 6 basic features for assessment of temperature over any swelling. If you've not seen that video, you can get its link in the description below. Now we are moving ahead with the next feature of palpation, that is tenderness. It can be simply defined as a painful sensation which is felt on applying moderate pressure over any body part or lump or swelling. It is a sign of tissue damage and commonly seen in inflammatory and traumatic swellings like abscess, cellulitis, hematoma, fractures, etc. And the most important point in this definition is moderate pressure. Because if you say that tenderness is a pain felt on applying pressure, then it will not be correct, because this definition doesn't decide the severity of pressure. And it is obvious that after a certain amount of pressure, you will feel pain on every body part. In other words, you can say that the pressure which normally doesn't give any pain to a normal person, if that pressure gives some painful sensation on the swelling, then probably there is some inflammatory or traumatic pathology inside. The other common mistake is if you say that it's a pain felt on touching. This is also wrong, because if there is a pain felt on touching, then it will be better called as hyperalgesia and not the tenderness. So the most appropriate way to define the tenderness is a painful sensation which is felt on applying moderate pressure. Now let us understand the difference between these two terms, pain and tenderness. Pain is a symptom because it is complained by the patient, and tenderness is a sign because it is found only by a doctor during his clinical examination. And there is no rule that both of them should occur together. In some cases you can get only pain, and in some cases you can get only tenderness. Say for example, if you are having headache, then in that case you get pain, but if you apply pressure on your forehead, there is no increase in pain. On the contrary, you feel relieved. So in case of headache, there is pain, but there is no tenderness. And opposite to it, now imagine that there is a patient who has come to you with a complaint of, say, loose motion, and he has got some inflammation in his colon. Now he is not having any abdominal pain, but when you apply the pressure on some points of his abdomen where the inflamed colon is present, then he will definitely have some abdominal tenderness. So in this case, there is tenderness without pain. So there is no rule that if there is a pain, there must be tenderness, or if there is no pain, there cannot be any tenderness. These two terms are quite different and they can be present independently. Now in my last video, we had seen that the palpation of any swelling should start with the assessment of temperature, and there was a logic behind it. Now if you pick up any book, you will find that mostly after temperature there is assessment of tenderness. There is a second parameter which should be assessed. Now why this assessment should be done very early? Well, obviously if there is some tenderness in the swelling, then you will definitely handle it in a different way in rest of the palpation. You will be more gentle and more soft in handling a tender swelling. So it will be better if you assess for tenderness in very early phase of your examination. Now coming to the most important point, that how to make an assessment of tenderness in any swelling. But it sounds very simple. Anybody can say that, okay, I'll do one thing, I'll press the swelling and I'll ask the patient that, is it painful? If patient says yes, that means tenderness is present. If patient says no, that means there is no tenderness. Well, this sounds very easy, but this is not the appropriate method to assess the tenderness. And as I told you in my last video that during the student life, the method is more important than the result. So if in your exam you say to your examiner that tenderness is present or absent, then probably he'll be more interested in assessing that how did you assess tenderness of that swelling. and you may have to perform a live demonstration of the procedure. So this method is not accurate, and the real method is indirect method, in which you have to do 3 acts simultaneously: talking, pressing and watching. First, you will have to talk to the patient, and this talk should not be about his problem. It should be about something different, say about the family or about the residence or about occupation, so that patient's mind is diverted away. Simultaneously, you will have to press the swelling. The pressure should be mild initially, and gradually you should increase to the moderate level. And along with this, you should keep an eye on the facial expressions of the patient. So if there is any discomfort at any point, there will be certainly some change in the facial expression of the patient. Because we know that face is one body part where any sign of discomfort comes very early, especially in this brow area. So this is the indirect method, in which you don't ask to the patient, rather you divert patient's mind by having some talk, then you apply some pressure over the swelling, and then you watch the facial expression, and if there is some change, that means tenderness is present. Okay, that sounds good, but what is the problem in that direct method? It was quite easy. Then why it is not accepted? Well, the reason is that the result obtained by this direct method, sometimes they are not reliable. Because in some cases, a patient may falsely and deliberately increase the severity of the problem, only to gain sympathy and a good treatment from the doctor. While in some other cases, the patient may hide the problem, mainly because of the fear of some major treatment, although it is comparatively rare. Well, whatever the condition may be, but it is not always accurate to rely on the answer given by the patient. And it is better to use this indirect method over the direct one. Because by this method you will be able to do a better assessment of presence, severity and site of tenderness. You can be very sure that whether tenderness is present or not, because here you are not asking to the patient, you are watching the facial expressions. Second thing about the severity, if tenderness is severe, then patient will feel discomfort only on mild pressure. And most importantly, if you are examining a large swelling or some large site like say abdomen, then you will not have to ask patient repeatedly at every point that whether it is painful or not. Because say for example you are assessing tenderness in whole limb, then you will keep on pressing at the multiple point and you will keep on watching at the facial expression of the patient. So wherever there will be tenderness, patient will definitely give some sign of change of facial expression. So direct method is easy, but indirect method is more accurate. Now the next question, what is the advantage of having a talk with the patient? Well, the one thing which I said earlier, that this talk diverts patient's mind away from the pathology, and for that reason it should not be related to the disease. It should be about something else like residence or occupation or family. And the other important thing is that you should be prepared to have a long talk. Sometimes if you are examining a large swelling or some large area like abdomen, then in that case this process will take some time. So there should not be any repetition of question, or there should not be any long pause. So in that case, be prepared for a long talk with the patient, not related to the disease. Now the other important advantage of having a talk, apart from diverting patient's mind, is that it gives you an opportunity to have a constant look at the face of the patient. Because I hope you can imagine that if you silently stare at your patient's face, after a few seconds he or she will start feeling uncomfortable, that why the doctor is staring at me. But here in this case, because you are talking to the patient, you have got full right to have a direct and continuous look at the face of the patient. So talking is a very important and essential step for this indirect method. Now, what are the possible signs of discomfort? Well, facial expression is a good sign, but that is not the only one. Here's the list. So, some patient, mostly the patient, they present with the change in the facial expression, especially in the forehead region. Sometimes patient may produce some vocal sounds. Whenever patient feels some pain, there is some sound which is called as vocal coos. Some patients clench their teeth or feast. In some cases, patient will try to withdraw the disease part which is tender. In some other case, the patient may resist the examiner. By some other hand, the patient may try to resist your examining hand. But the most common answer which you will get in the practice is that patient gives you the answer without being asked. Patient will simply say that it is painful. And obviously, if you are examining a small child, then in that case, cry is a very important signal. So why I am giving you this list is because you should not rely only on the facial expressions. These others are also the equally good signs for discomfort, and you should keep your mind open for them also. And finally, what to do if there is no signal? Patient is not giving any vocal or any visual signal of discomfort. Then can you say that swelling is non-tender? Well, the answer is mostly yes. But to be very sure, at this stage, you should ask the patient that whether it is painful or not. Because in some cases, the swelling has got only mild tenderness on deep palpation. So in such cases, if you rely only on the indirect signs, probably you may miss the tenderness. And interestingly, now patient cannot fool you by exaggerating the problem. So if there is no signal, then it will be better to ask the patient before coming to any conclusion. So thanks for watching this video. If you liked it, please share it with your friends and subscribe the channel. We'll meet again very soon with some other video on some features of palpation of swelling. Till then, stay healthy, stay safe, and always keep learning in your life. Goodbye.